Welcome back. This is Sunday Breakfast right here on ChannelOne TV. You just heard there my colleague Eno's really exciting conversation with Reverend Benny. You know, all of the insights. If you missed any part of it, you can go on YouTube, ChannelOne TV. All of the conversation would be there, and share and get somebody inspired by all of those nuggets of wisdom. But it's now time for a health conversation. Dr. Kalsum joins us in studio, and we are continuing, a series we've started on cervical cancer all through the month of January, and this time it's taking a different turn. Like Eno mentioned to you, it's now time to hear from, let me say, someone who is going through this ordeal, right? And to be fair, doing fantastically well, and we'll be hearing more from her later on the show today. Doc, good morning and welcome to Breakfast Day, Sunday Breakfast.
Good morning.
Yeah, I hope you are well.
Very well. And
wow.
You?
I'm thriving, I guess. People say January is going very fast.
Yes,
you are doing a lot of work in the space, right? Like your January has been so busy, I can imagine.
Yes, very busy.
Kumasi, Fomina, Wasi, organizing conferences. I don't know. How's the month been for you?
For me, I think it's been very fast. Yes, and there's a lot more to do concerning cervical cancer. So if you could slow down a little bit for me, I'll be happier.
I feel you. It's going fast for you because you are doing a lot within the period.
Exactly.
Amazing.
Yeah.
Wow. Last week we continued where we started off. We had you demonstrate for us,
the screening
practically.
Modalities. Yeah.
The screening modalities, exactly. Today, what will we be focusing on?
Okay, so today, basically, we'll be focusing on a journey with cervical cancer. So we have in the studio with one of us, who would take us through her journey with cervical cancer. And also, we'll be emphasizing on some of the things to show that it is actually not far away from us. It is very close to us. And if the message has still not gone out there, that you need to know yourself and you need to commit to a particular screening schedule. This is a practical and in a live patient for you to be able to take that decision if you have not taken that decision up till now. So you need to take that decision and make sure that you are doing the screening that you have to. And also, I'm sure would be encouraged by the fact that at least something can be done about it if you catch the disease early from this conversation that we are going to have with one of us. I'm sure it's going to be very interesting, and we'll be throwing some light on certain areas that we need to emphasize so that the public get to know that, yes, cervical cancer, as we have mentioned, is a highly preventable disease and is caused by HPV, and you need to commit to your screening schedules once you become sexually active so that you can catch it early, and catching it early would save lives, as we are coming to demonstrate today. And also, I'm sure Eno would take us through that. Absolutely. We have, if you have been watching up until date, I'm sure you've been educated enough. So we want to test to see if really you've been listening and you have been educated. So we'll be asking a few questions, and the good thing is that, sponsored by Lexter Ghana, we will be giving 5 ladies who answer their questions right free pap smear screening. So that would be communicated when Enu has the floor. All right.
Amazing.
Thank you very much.
Please do us the honors, right?
All right, so there are 5 questions for our viewers to get the freebies. 5 questions for our viewers to get the freebies. Now, if you get any of these questions right, the 5 questions I'm about to ask, if you get any of these questions right, then you get the pap smear. And you send the answer to the questions I'm about to ask to the number 0204 447 033. The WhatsApp number 0204 447-033. And whoever answers first gets the freebie. All right. So the first question, name 2 signs and symptoms of cervical cancer. Name 2 signs and symptoms of cervical cancer. Question 2. Name screening tests available for cervical cancer. Name screening tests available for cervical cancer. 3. What is cervical cancer? Question 3. What is cervical cancer? And question 4. What do you do when you experience any of the signs of cervical cancer? What do you do when you experience any of the signs of cervical cancer? Question 5. If you do a pap smear and it's normal, after how many years do you repeat it? So if you do a pap smear and the test comes out as normal, after how many years do you repeat it? So answer any of these 5 questions. If you happen to be the first person to answer it correctly, you could be just the one. And also, if you do win, we'll require that you give us your name and your phone number so that we can reach out to you to collect your prize. So the number again, the WhatsApp number, 0204-447-033. 0204-447-033. We'll require your name, your number, and your location when you send in those answers. Should I go through again? Just one more time. 1. Name 2 signs and symptoms of cervical cancer. 2. Name screening tests available for cervical cancer. 3. What is cervical cancer? 4. What do you do when you experience any of the signs of cervical cancer? And 5. If you do a pap smear and it is normal, after how many years do you repeat it? 0204-447-033.
I can answer and
please,
give the slots to some people. Wow.
You're not included.
It's segregation. It's no good.
Oh.
But guys, we are expecting
we're expecting
right?
answers. So
just send them in and get a chance to do this. Amazing.
All right. I think we can start our conversation, can we not?
Yes.
Yep.
All right.
You want me to start? All right. So as we said, we're going to speak to someone who has gone through this journey, and we're going to call her Akusia to maintain her anonymity. And so beginning the conversation, Akusia, thank you so much for joining us, and thank you for your bravery and the fact that you are bold enough to share your story with us.
Welcome.
All right, let's begin with this. Tell us your story when you were first diagnosed and what that moment felt like.
Okay. It started after I gave birth to my daughter. We were staying with my mom at that time, so within 2 months to 3 months time, my husband came in to take us to where we used to stay. So when we meet at the first time, I saw blood. So we were thinking it's like, we thought it was a menstruation. So we didn't tell anybody about it. So the second time it was same. I was bleeding. So he asked me to go to the hospital to find out what's wrong with me. So I went to Adesu midwife hospital. So I saw a lady there, and she advised me to go for a lab. So from there she told me to go to Amasamai hospital. So when I get there, they was trying to take a sample, but it wasn't easy at that time. I was bleeding heavily, so the doctor decided I should go to Kolebu for a proper checkup. So I went, the next day I went to Kolebu for treatment. So when I get there, I saw a doctor there, but he was able to take a sample, and I took it to the lab. Within 2 to 3 weeks time, I went there again, and they told me I had cervical cancer. So they gave me medication and prepared me for surgery. So they gave me the dates and everything, what is needed there, and I went for the surgery, and it's successful.
That's great. Prior to your diagnosis, did you know what cervical cancer was?
No, at that time
You had never heard of it?
Yes, please.
So when they told you that you had cervical cancer, what went through your mind at that moment?
It wasn't easy. I cried. So the doctor consoled me. She told me it's good I came in early. So it was okay by me. If they are able to save my life, because my daughter is too young. So I accepted everything they told me, and I did it.
How old was your daughter at that time?
8 months.
Wow.
Okay.
How did it affect you mentally when they told you that you were going to go for surgery?
It wasn't easy. At first, I denied. So my family, my husband advised me to go for it, and it's good if I go for the surgery because of my daughter. So I accepted it, but it wasn't easy.
After the surgery, what kind of treatment have you undergone or still undergoing?
I went for CT scan and pap smear.
Take us through the pap smear. What does it feel like when you go for pap smear? Because that's one of the things that women think about when they want to go for screening. They are concerned about, is it going to be painful? What are they going to do to me? Tell us your own experience of what a pap smear feels like.
Okay, when I get there, it's okay. It's not scared. It's free. You open your legs, they insert the instruments, and just take out the sample. That's all.
Interesting. Hi, Akosia.
Hi.
Yeah, Jude here. I'm also interested, and like Eno rightly said, we really applaud your bravery in all of this, and also choosing to share a story. I'm interested in finding out from you how you held on, right? What kept you very strong and motivated during this whole process? Or what has kept you, still very motivated even as you go through this?
My mom and my friend, my sister. They have been there since, and let me say my husband, my baby daddy. Yeah.
Sorry, I didn't get that. Your husband's?
we break up, so she's my baby daddy now.
Okay.
Yeah. He was there too at that time, but my mom, she's good.
Okay. All right, Akosia, so how old are you now?
I'm 30.
30 years.
Yes,
okay,
please.
great. And this happened when you were about, that's 2 years ago, so when you were about 28 years.
Yes.
Is that correct?
Yes, please.
Okay. So what type of treatments were you giving? What type of surgery? Do you know the type of surgery that was done for you?
Yes. I said I had cervical cancer stage 1B.
Okay.
And around my womb. So they said they can't take out some and leave the rest. It will affect me, so you have to take all the womb.
Okay.
So that I'll be free.
Okay. All right. So you took out your, so they did a radical hysterectomy for you.
Yes,
where
please.
the whole womb was taken
Was taken out, yeah.
Okay, all right, great.
Wow, Doc, how, let me come to you. How common is her story, right? On an average, how often do you hear stories like this? And for me, is when she talks about how society approaches some of these things, people she thought she was in for the rest of her life with, automatically now, I just wanted to touch on the commonality of some of these cases.
Okay, so as we mentioned, maybe to make it very, very practical, we have the statistics globally where we say that cervical cancer is highly preventable, but you tend to have about 3,072 of new cases every year globally, which was reported in 2022, and then out of that you have 1,815 ending up losing their lives. So when you say that, that is global, but let's look at it locally, where out of, let's say, 10 people who do present to you, out of that, most of them do present at a stage where the disease is very well advanced. And when the disease is very well advanced, it means that it does not stay only in the uterus and the cervix, but it is affecting other adjacent structures. So in such a case, surgery is not even an option. So out of that 10, if I should tell you, 9 of them would just have to have other adjunctive treatments, and they may not be able to live past 3 years out of that. So maybe just one may present at a stage where it is still early, where you can do, just like for hair, you can do a radical hysterectomy. Depending on where you find in theater, you may end up continuing with some radiation therapy or chemotherapy to be able to take care of all the other spread or the metastasis that is in there. So this is how close it is to us, and not very far away. If you look at global statistics, you may think that, oh, these figures, it is very far away from me, but it is not. So out of 10, imagine these patients who do present with signs and symptoms that was not picked up early. This is actually the reality on the ground. And remember, she's only 30 years. Most people say that cancers do affect people who are older.
Yeah.
So the lesson here is that as young as 30 years, you can come down with cancer. So it is not far away from you. And the sad thing is that it's a cancer that is preventable. So if you start your screening schedule early, you should be able to catch it early. For her, she mentioned that she had been in a relationship barely 4 years before she started. I mean, before she gave birth, and then eventually she had the baby, and then she had all of these symptoms 7 to 6 months after giving birth. So imagine 4 years. This emphasizes what? Screening. If you start screening early, before that 4th year, you would have been able to pick up the changes that we have been talking about way early before it even becomes full-blown cancer. And I must commend her that as soon as she started seeing the symptoms, she did not go see a herbalist. She did not go see somebody in the corner somewhere. She went straight to the hospital where the needed screening was done, and then she was referred to the right facility for the diagnosis to be done, and then the treatment needed given.
Wonderful insights on the statistics and the data. I appreciate that. Also on the kind of treatment, how common is it, when you come to Kolebu, how often will I hear cases like these?
So it depends on, as I said, the staging. If it is early stage, yes, you would get a fee. But the sad thing is, most people don't come early. Most of the time is late stages. So if it's late stage, even you having radical hysterectomy will not be an option. You've gone past that. because it's the tumor has spread to other areas. So doing that alone will not solve the problem. So you may have to resort to the other modalities of treatment,
and
which is either chemo or radiation or palliative.
We are so sorry for the situation you find yourself in, but just and of course thank you again for sharing your story, but just for the benefit of our viewers out there, would you describe her situation as a late one?
No, I won't. It was, as she rightly said, it was staged as 1B, which is an early stage. So early stage, you can go ahead and do your radical hysterectomy, which she has done. And then subsequently go ahead and then do some investigations like a CT scan, repeat, to see if everything has been taken out. And sometimes, and she'll need to be on planned follow-up as well.
Planned follow-ups?
Planned follow-ups. Thankfully, it's been 2 years since she had her surgery.
Wow.
And she would have to go through doing some serial CT scans. And if, hopefully, if everything is okay or not, she may have to have some radiation therapy or chemo radiation therapy.
On the point you raised about the planned follow-ups, right? I just want to hear from Akosia very briefly. Akosia,
Sir.
How has life changed for you, right, since this?
A lot.
Wow.
Tell us about it.
My friends, some avoid me. And my baby daddy and his family too. It wasn't easy, but thanks to God and my family, I'm okay. I'm okay now.
So that means you're facing stigma from your diagnosis and misunderstanding.
Yes.
Wow. That's interesting.
Yes.
How has cervical cancer changed your outlook on life?
Okay, at first I was active, but now sometimes I feel weak and some pains too. Yeah, but apart from that, I'm okay. And I live normally as I used to be, just that when the pain starts, I can't do anything about it. That's all.
There are many women who are watching you now and may be afraid to go for their screenings or, go get checked. What kept you hopeful through your moments, through those times that you were going through the surgery and everything? What kept you hopeful? And what would you tell those women who are looking at you and are scared to go for screening?
It's not scared. When you hear it, it seems it's something dangerous, or let me say, but it's not scared. It's easy. And it's okay for every lady to go to the hospital to do the pap smear. Even if they tell you to do the surgery, my sister, do it and you'll be fine.
Very important words from us, our dear friend Akosia. But how important were healthcare providers? I'm sure you say very nice things about Dr. But in the generality of it, right? So from the nurses you met, the lab technicians, even the doctors, right? How supportive were they?
My doctor, he's a good person. And the nurses too, they are friendly. Yeah. I was there for almost a month. Yeah, but they are so amazing. Yeah. And my doctor too. Thanks to him.
Shout outs to the Kolebu Oncology Department. We hear very nice things about them. Interesting. Akosia, you talk about how your life has changed a lot, even to the point of being jilted by your ex-lover. how has this also affected other things, right? So, for example, your work or your school or life in general?
No, it doesn't affect my work. I'm still working.
Interesting.
Doc, I want to ask, you know, we talk about women and how can men be more supportive in such situations?
Or maybe you should ask me.
By you then, doctor.
Yes.
You can chip in after
To
Doc.
be fair, I've not had to live with a survivor or a
Right.
surviving patient, so true.
Yes.
But I'm a man.
Yeah.
And
So you want to
I-
say something before?
Yeah,
Doc?
listening to her story is so unfortunate, right? And I really applaud her bravery, like you rightly said, and her strength in some of these, or in this ordeal, right? And I think generally, you know, we need to do better. You know, this gender. Sometimes the other gender,
Say your agenda.
you know, but we need to do better, right? And I hope that this will be a story that will inspire and also act as a reminder that, you know, you can't enter some things and just, you know,
Yeah.
Back out.
exactly.
Exactly. So social presence, very important for your partner. You've entered into this partnership and you are in this together. So it doesn't mean that if something goes south, then you abandon the whole contract and then leave. You need to be there. You need to support socially. You need to support emotionally. You need to support financially. So these are the areas where you need the men to be able to support the women, so that if they do know that they have such a strong support system or a social system that would always be there for them, it is very therapeutic for the patient, and they would be able to go through this journey all the way to the end of it. But we don't recommend that you just abandon the patient halfway through, or decide to say that, I mean, it's over or whatever.
And this is true for cervical cancer as it is for
any
every other
disease.
condition.
Wow.
Any other condition.
Akosia had so many nice things to say about Kolebu, where you work, and of course the doctors that treated her, including yourself. Will you say this is the norm in terms of healthcare professionalism, healthcare quality?
I know where Jude is going.
You know, Doctor Charlie, I read the news
Patience.
review segment.
Yeah.
Upper East 26 posted, only 3 showed up. Right, these are doctors already. You know, so is this the quality standard treatment?
Yes, so when you look at the quality dimensions of health, it is one of the things that you need to be able to, because sometimes just by speaking to a healthcare professional and how approachable and the rapport you build with the patient goes a long way to, even sometimes there's something we call placebo effect, just by talking to you and how you give me that listening ear.
You feel better.
You feel better before I even intervene with any medical intervention. You get it. So psychologically, you need to psych the person up. And I would say that most healthcare professionals are doing their best in this regard. The only challenge is that the number of patients that you may have to see sometimes compromises this quality. So if you are going into the consultation room and then just before you even enter, the numbers that you see out there, it reduces that patient-doctor time that you spend, and that is what takes
affects
out
the quality.
Exactly, the quality that you may have to
So
give
it is not
to
a
the
personal
patient.
problem.
No,
It is
it's
a
the
policy problem.
It's the system.
So the system.
Exactly.
Mita
Where you
kando.
have a
Have not
number
been
of,
kando.
you know, so I think every healthcare professional would want to leave any patient who came in smiling. And nobody would want a patient coming in and leaving even worse than they came in. You would want to listen to them. You would want to be able to allay all their fears before they leave. And most of the time, it is very, very important and very therapeutic. Some will just say that just by talking to you, doctor, thank you very much. Just by giving me that time for me to speak, and then you listened to me and you answered all my questions, and you were able to take care of all the doubts that I had in my mind. It's enough therapy for the patient, and that is the goal for every healthcare professional.
Wow. We have some answers to our questions. They actually answered all 5. Interesting. I love our viewers this morning. So this one is from Safo. But Safo, you only wrote Safo. You didn't add anything. But anyway, cervical cancer is a disease which abnormal cells grow uncontrollably in the cervix, the lower part of the uterus that connects to the vagina. Signs and symptoms of cervical cancer: abnormal vaginal bleeding, bleeding between periods.
You have to use Tenitino and check for plagiarism. You read it, I'm doing it in my mind. If I hear some words, I'll do it.
You know that it's AI, right?
Exactly.
After sexual intercourse or after menopause, unusual vaginal discharge may be watery, thick, foul-smelling, or blood-stained. Pelvic pain or pain during sexual intercourse, especially if persistent, and that's from Safo. Another one here, Margaret Tennyson. Question answers: pelvic pain or pain during intercourse for the number 1. Number 2, abnormal vaginal bleeding. Number 3, unexplained weight loss, fatigue. The answer to question 2, a pap smear test.
Let's give
it to them. And then Felicity Ahafia, also same question. Cervical cancer is the abnormal growth of the cells of the cervix, mostly caused by human papilloma virus. And then she goes on and on, answers all the 5 questions. So
people have been listening.
Yeah, I'm so proud. I'm so proud of all of you.
Also, a big word on to you, Doc, for your fierce and relentless advocacy.
Thank you.
Wow.
Generally, I wanted to talk about
Abdul Rahman D. Nasi also sent in a message. Cervical cancer is
Abdul Rahman.
Yeah, maybe he wants it for maybe his sister, his wife.
Yeah.
You never know. Yeah, so the answers are here. Early detection improves outcome if normal. Repeats every 3 to 5 years, depending on age.
Are they more than 5?
No, this is the 4th person. So one more person sends in, and
that's it.
Okay.
Wow.
I'm very happy.
I was saying thank you too for showing a lot of relentless advocacy.
Thank you too.
And also strong leadership with the women of Medical
Women Association of Ghana.
Yeah, I saw some of them in the course of the week. Was it last week? I think even this week on Breakfast Day. So I've been sitting with you. I was like, oh yeah, you're following. Anyway, Doc, thank you so much.
Thank you too.
Yeah.
Thank you.
Doc, there's a question here for you. Lester wants to know if someone can have cervical cancer without symptoms.
Yes. You can actually have. So you can actually have the early stages. You may not have any symptoms.
Right.
So as I mentioned, that there are changes in the cervix, and it depends. Persistent infection of HPV, then it will start forming changes in the cells, dysplastic changes, then the dysplastic changes will move on, and then you start the early stages of the cervical cancer and all of that. So if you do have those changes, that's maybe you don't have the growth has not happened yet, such that, and you are not sexually active at the time, so you don't have that bleeding episode,
right?
Like she did have the postcoital bleeding and all. Yes, it's possible that you may have the early stages and even the dysplastic changes at the stage where you may not have any symptoms at all. So that is one of the signs, not having any symptoms at all. So you having to go through the screening schedules does do a lot of good to you than harm.
Interesting. There's one here saying, well, it's not a question, but the person is watching us from Koforidia. I'm also going through the treatment, which I started last year, and I'll say the doctor there is doing well. Okay. So that's nice.
Shout outs to Ghana doctors.
Yes.
It's
They're
only when you
amazing.
touch their salary that they do some things. But they are lovely people.
They haven't gone on strike in a while. Let's maintain.
Shout out to Dr. Salome and Dr. Youngson.
They are doing amazing.
But there's a new one, right?
Yes, there's a new one.
The new GMA president.
Prof York.
Yes,
Prof York.
York.
I haven't started disturbing his peace
I've been
of mind.
seeing in some real they wear green and black and red.
Yeah.
You know, but he's a solid guy.
Let me
Yeah.
thank Akosia for coming.
Yeah.
Absolutely.
And Akosia, my last question to you though is, if you could speak to women out there, I just want you to speak to them directly and tell them what you want to tell them, especially about cervical cancer and how important it is to go for screening.
Okay, thank you. Ladies, women, please,
Girlfriends, side chicks,
Even the men, encourage your women.
please,
slave
I
queens.
advise you to go for the screening. And if they find out you have cervical cancer, please follow up, do the surgery, everything, take your medications, everything perfectly, and you'll be fine.
Absolutely.
It's not scared. It's normal.
Thank you
Thank
so
you.
much, Akosia. And God bless you and
Amen.
your journey. And you are very brave.
Yes.
Thank
If
you.
no one has told you, you are very, very brave.
Great.
And Dr. Thank you so much for your daily education on this. We
Thank you
appreciate your
too.
time. We appreciate the work that you and all the other women in your association are doing.
Yeah, thank you
And,
so much, and Akosia too. Thank you so much for coming.
Yeah.
And we commend you for your bravery. Commend you for not hiding the symptoms when it started,
Yeah.
but going promptly so
Definitely.
that the needed attention is given. Very, very important. Thank you so much.
You're welcome.
And
All right.
remember, early detection saves
I
lives.
was just about to say that. Early detection saves lives. So all the women who are scared to go for screening, please go. My director says I shouldn't mention her name, but I'll still mention it. Pearl, I'll take you there personally and we can go do the screening together.